It really is an honor to be here with so many of you who are on the front lines of making our labor market work better for people, for Americans, for workers, for employers, for communities, for our economy. Karen mentioned, in many ways, I think Workforce Realigned Volume 2 is based on a simple but powerful question, which is how can we design systems that create better workforce outcomes for Americans and do so in a way that's financed more fairly, that's sustainable, and that brings all the relevant parties to the table. What we're going to grapple with here today on this panel is one of the central ideas and innovations that we wrestle with in different chapters of this book, which is new financing models. How can we move away from the binary that to some degree we're trapped in, which is one-time grants or scholarships on the one hand, or high interest, sometimes predatory loans on the other? And how can we think differently about blended capital or just deploying capital differently from public, private, philanthropic sources? In the plainest way, the way these models work is you've got low income or overlooked learners who have access to zero interest outcomes-based loans and wraparound supports that give them the ability to participate in and complete high-quality trainings that are aligned with good careers. Those loans are usually last dollar, right? They come after Pell, come after other aid, but most importantly, they're repayable only when somebody succeeds. So only when somebody gets that job that pays above a certain amount are they repaying. And then when they repay, that money comes back to support another person. It recycles. It creates a flywheel. It creates kind of that pay it forward cycle that can keep supporting more people. And then foundationally, the capital that starts that flywheel going, whether it's from a state, whether it's from a corporate treasury, whether it's from a philanthropic grant, that's the risk capital that's getting this done. So that when there aren't great outcomes, which inevitably there aren't 100% of the time, that risk is now shared among different parties. And it's not borne only or solely by the low-income learner who is really the least able to bear that risk of everybody in that picture. So this is what we're going to talk about with this amazing panel here today. I have three phenomenal speakers with me and leaders with me today. Tara Colton is the Chief Economic Security Officer at the New Jersey Economic Development Authority, where she leads a $300 million portfolio focused on food security, childcare, and workforce development. She was a key architect of the New Jersey Pay It Forward program, the author of our chapter, one of the country's first state-led outcomes-based workforce funds. Tara has spent over 2 decades designing programs that support working families, including roles in New York City government and national nonprofits. We have Jeannie Verdon, who's the Chief People Officer at Central Health in Texas, where she oversees all aspects of HR and talent strategy for a system serving over 150,000 residents in Travis County. She's also a founding employer partner in the Renew Fund, which is a partnership with Social Finance and WGU addressing the country's acute nursing shortage by building a sustainable and locally rooted talent pipeline. Jeannie brings to that work in this conversation over 15 years of leadership in healthcare HR and is, I can attest, deeply committed to improving the employee experience and expanding access to opportunity. We have Dr. Shanika Hope, who leads the Americas and Knowledge, Skills, and Learning portfolio for Google.org, where she and others oversee $200 million in annual philanthropic investments worldwide. Shanika is a part of the leadership team that designed the Google Career Certificate Fund, $100 million blended capital fund that uses Google's own balance sheet and grant dollars to catalyze wage gains for learners in the tech sector. Shanika brings a really special combination of deep experience in K-12 education, ed tech innovation, and philanthropic strategy perspective to this conversation. So we're going to dive right in. Maybe we can start with each of you taking just a minute, because everybody may not have yet had a chance to read each chapter of the volume. Just a brief summary of your work, but also the work you describe in the chapter of Workforce Realigned. Tara, can I ask you to start?
Sure. Can everyone hear me all right? We were saying in the green room that we look like we're part of a girl group because we have these like headphone things, and we managed to, none of us were the same color, but they all complement each other. So really kicking us off quite nicely. So good morning, everyone. Really thrilled to be here. So again, I'm Tara Colton. I'm with the New Jersey Economic Development Authority, which is the state of New Jersey's government agency focused on growing the state's economy. Since 2020, as you'll see in chapter 11, I think, I'm in somewhere in the middle of the book, we have been launching, designing, and implementing the New Jersey Pay It Forward program, which started as an idea at the height of the pandemic, was a $5 million public commitment, $5 million private commitment, and really accelerated when we started working with two key stakeholders, the team at Social Finance and a future team member of Social Finance, my former colleague David Sokolow, who was the head of the Higher Education Student Assistance Authority in New Jersey. So you put those two together, and we are now at a $25 million outcomes-based loan that is on track to serve over 1,000 students in New Jersey. So really excited to be here to talk about that.
Hi, I'm Jeannie Verdon. I'm the Chief People Officer for Central Health. We're located in Austin, Texas, Travis County. So our chapter is really about our very new partnership, not only with the Renew Fund, but with WGU, and really building a sustainable pipeline of RN candidates from the communities that we serve. So very excited about the alignment with WGU's mission, about the Renew Fund, how they fund the education, and then as an employer, how I can tap into that and support the candidates that are going through the RN program.
Good morning, everyone. Again, Shanika Hope. I'm thrilled to be here. Super excited about the conversation with my girl band here. I have the incredible fortune of leading the knowledge, skilling, and learning portfolio within Google.org, which is Google's corporate philanthropic arm. And Google has had a long-standing commitment to workforce development, specifically innovation with regards to workforce innovation. It started for us really with several key investments starting in 2017, where we initially made a $1 billion commitment, global commitment, to invest $1 billion over 5 years to really focus on those communities that are underemployed and also having access barriers to some of the high growth, high demand sectors. And along with that $1 billion investment, we also made a commitment of 100 million volunteer hours to nonprofits that are focused on workforce development. And again, wanting to be very intentional about how do we best deploy our products, our people, our philanthropy to really push for progress. And in the chapter that was actually written by the founder of Grow with Google, Lisa Gavelber, the chapter really lays out this opportunity that we saw that in America, we're finding that less than 40% of Americans actually hold a college credential. But according to the Brookings Institute, 70% of new jobs that are placed for hire looking for talent, one of the first indicators that they're asking for is that college credential. And so we're finding that a large majority of our citizens are locked out of some of these high growth, high demand opportunities. And so what our chapter lays out is our commitment to wanting to find more innovative, transformative ways, because what we know today is that a lot of the promising practices with workforce development, they're oftentimes they're invested or supported through philanthropy, which really makes scale incredibly difficult. And so the $100 million Google Career Certificate Fund was really focused on three things. How do we find promising nonprofit workforce development agencies that are doing incredible work? How do we identify them, elevate them, and provide scalable investment? And look at these promising practices and center them on learner outcomes. And then ensure that the incentives are learner-centered. So when training providers need additional investment to support more workers, And then those that are coming in to provide that finance also has the incentive to ensure that those outcomes are focused on the learner securing high, livable wage jobs that also have upward mobility. And so that's what the chapter lays out. And so the chapter also pushes on this hybrid funding model where the funding brings in that corporate philanthropy, but also brings in the balance sheet investment from Google Treasury, because we recognize that, again, back to balancing the risk, we needed to de-risk that financial investment so that the learner is freed up to focus on the learning, get those wraparound supports, but then industry and corporate and government are coming alongside to sustain it. Yeah. So that's what we're laying out there.
I love that. So let me build on that point about risk. I mean, and you talked about, and I think in many ways, what is animating, all of our engagement with this work is to say there are people who are locked out of opportunity. How can we rebalance risk and bring new parties to the table in a way that unlocks that opportunity, that unlocks that access? And in traditional workforce models, oftentimes, learners are, particularly low-income ones, are bearing all the risk. They might have to take out expensive loans. If they don't complete the program, if their car breaks down and they can't get to the program, they can't find a good job, they're left with debt and no upside. At an event a year ago, somebody called it the only model where somebody takes out debt for an equity-like return. It's not rational, right? And it's not fair. So the model we're all talking about has this outcomes-based feature to it. So I'd love, Tara, maybe I can start with you. I mean, the work you have led at the New Jersey Pay It Forward Fund is one of the first of its kind led by a state. I know you and I have talked about, the trade-offs that you considered when designing repayment thresholds. You talk about it in the article and downsides protections. How did you think about those trade-offs and the state's perspective on reducing students' risk, but also creating some form of sustainability? Talk us through that.
Yeah, so trade-offs is a key word. I think priorities is the cousin of trade-offs. When this idea was first conceptualized in the summer of 2020, there was a belief that this concept was going to be almost magical, and I think we had to do some reality checks once we started wrestling with how to achieve some of that desired magic. So there was this idea for this recyclable fund that was going to last in perpetuity, and it was going to be the most student-friendly product that ever existed, and all the people who graduated with these loans were going to get jobs exactly at the corporations that were paying for the loans, and we were going to have all the protections built in, but we were not going to burden the students with the repayment costs, and some of those things that I just said are in direct contradiction with one another, particularly the recyclability and the life, the horizon, the time horizon of the fund. And so we had to consider the trade-offs, and we had to really decide where were the bright lines. What did we care about the most? We couldn't care about everything because then we didn't care about anything. And so we spent a lot of time. I was a half dozen state agencies in the state of New Jersey under the leadership of Governor Phil Murphy, who has really been the one who championed this and charged us with working together to come up with a model that aligned with not just the vision for what this outcomes-based recyclable loan could do, but also the state's principles. And Governor Murphy has built his administration on a stronger and fairer New Jersey, and has been very committed to expanding affordability in higher education. And so when you couple that with the reality that in New Jersey, we had a good problem in many regards, which is that for lower income students, associate's degrees and bachelor's degrees, the tuition was essentially free. If you want to use the shorthand of free community college, that's basically what we have in New Jersey. We recognized there was a gap for students who were pursuing or interested in pursuing credential or shorter term training programs. And then we had this sort of aha moment that focusing on tuition wasn't the only criteria. We also needed to consider the increasing share of costs that are being put into fees, and realizing that some training programs are either off limits to students because they just self-select out. They make what is probably a responsible financial decision and don't even pursue it in the first place. Or they enter into the program and in many cases don't complete, or complete but aren't able to get a job in the career they were training for because life gets in the way, and they still have the same amount of debt, but without the employment outcomes to show for it. And so we had to decide what was the problem we were solving for. We were sort of trying to find a bullseye between the careers where there were going to be paying enough when a student got a job, where the training was expensive enough that there was some fund economics that made sense for them to borrow from the funding we made available, but also that if not for this funding, students, particularly the students we were trying to get into these fields, particularly nursing and the allied health fields, wouldn't have had a clear pathway to the middle class. And so once we realized that those were our priorities, then it helped to click into place what were some of the things that we were willing to deprioritize. And some of that was the life of the fund. I will say, kind of in closing on this, that we started this in calendar year FY20. We are now in our 5th year, and Governor Murphy has included funding for Pay It Forward in his budget for the last 5 budget cycles, including this most recent one, which was by far the hardest and tightest budget cycle that we've had. So there is some additional funding that has continued to grow the resources. Even if it doesn't last for 10 or 20 years, I think we feel very comfortable with the choices that we made.
Yeah, over $25 million now.
25.1.
Could I double click on
Yes.
one of Tara's comments?
Who's counting?
What I love in your reflections is the point that you had to make a decision on what you were going to prioritize. And I think oftentimes when we look at the problem space, there are a lot of important things that we could tackle. But what I love about the volume specifically and about our collective work is that we all recognize that this is going to take a broad set of supporters, stakeholders to show up, because this is a systems matter, and that we all can play a different role. And so one of the things that I love, and having looked at the broader volume beyond just Google's contribution here, is that one of the things that we were intentional about when we thought about how the fund would operate is a recognition that we needed a diverse set of training partners who were looking to support the problem space through a different lens, through a different approach, prioritizing a different set of stakeholders, whether it's veterans or those that are underemployed or those who have some credential but were unsuccessful in completing. And one of the learnings from that, and in particular as I listen to your reflection, is that we need a broad range of stakeholders who understand and see their part in the system. And then with the innovative financing, the intent is really to de-risk it so that these various stakeholders can show up, anchor on serving the learner well, but also have shared responsibility in the success of the learner. And I think that's critically important. It takes all of us, but we have to prioritize, understand what our part of the system is, and be focused and aligning our support, our resources to a common outcome. And then we all win.
I love that. And Jeannie, it makes me think of you and the way Central Health is showing up. So in the Renew Fund, which is applying this model, outcomes-based, principal-only loans to nursing students at Western Governors University, who then become RNs. And then what Central Health has done, which is a remarkable commitment, talk about showing up and making a different type of commitment, is when those students graduate and become employed by Central Health, Jeannie and the team actually repays that loan on their behalf over time. And that you led the charge there, Jeannie. That's no small feat. There's plenty of ways that you look to support your employers, that you look for talent, but you did something new here. Talk to us about that decision and what it took to get there.
Yeah, absolutely. So first of all, I have to thank everyone who has gone ahead and paved the path forward. I actually had the easiest lift, if you will. And so Central Health, we're located again in Austin, Texas. We're the Travis County Hospital District. That includes our health plan as well as a community health center. And so one of the problems that we always have in a very competitive medical environment is hiring RNs, hiring our frontline workers. And a lot of that is because being a quasi-governmental entity, one, the investments that we can make are minimal, other than just employing our team members and that type of thing. But then two, having the people from the communities that we serve, because our patient population is the underserved and underrepresented residents of Travis County. And so we're always looking for innovative ways to support the team members, but we don't necessarily have the financial portfolio to do it directly. And so I happened to be at a conference about a year and a half ago and met with Social Finance and WGU, and they told me about this wonderful new model that they had. And I was like, all right, loan repayment, got it, get it, right? So they started talking about it, and I was like, wait a second. This is so unique and such a great opportunity for us as an employer. One, WGU, like I said earlier, they have the same mission, the same student population that we want for our candidates and for our team member population. So there was alignment right there. Two, the funding was already in place. The mechanism was already there for these candidates to be able to go into the program and have the support that they need, inclusive of being supported through their clinical rotations, because a lot of times that's where we see people are dropping out, because as someone said earlier, life happens, right? They don't have the time or the ability to stop working their full-time job or even a part-time job. They have obligations at home, and so a lot of times they don't even complete the program. And so this supports them. And then once they graduate as an employer, there's no obligation for the students to come work for Central Health, right? But we are an option for them. We hope we are the option, and we hope that it's a very good partnership. And while they work for us, then we repay their student loans, which are zero interest student loans, first of all. So even if they don't choose us and they have to go to another agent or to another employer, they're paying zero interest fee student loans. But if they come here, we as an employer will repay that as long as they are working for us. But the value proposition is that instead of like traditional loan repayments or things like that, it goes back into the fund. Yeah. And so therefore, we're creating another opportunity for another student to step into that role. And so it's a cycle, and it's a very, very exciting cycle that can expand the nursing candidacy and the opportunities. I think one challenge that we have is there's not enough nursing programs, right, for all of the people that would like to go through it. So I think that's another problem for another day. But as an employer, it was really, to me, it was so easy to say, absolutely, we need to do it. And actually, when I took it to my CFO and my CEO, I was like, all right, we're going to have this conversation, and I was expecting pushback. But amazingly enough, our CEO and even our CFO, they saw it instantly, just like I did, and they said, yes, let's do it. And so we are very excited to be the inaugural employer for this fund. And it's wonderful because as an employer, I can champion it to our communities. There's, again, no obligation to us, but then we do have the ability to support them after they graduate. So again, from my perspective, easiest lift I have. Sorry, everyone else who did all the work, but thank you very much. But I hope that more employers will see that that's what their part in this is so that way, not only are they providing those careers that are sustainable, where they can grow, right? But then they're also providing opportunities for them to not pay back that student loan if at all possible.
Yeah. Okay, so we're not doing questions yet, but they're bringing up the mic. So I hope everyone's getting your questions ready, because these are three amazing women here, and I know you have things to ask them that I will have missed. But you talked, Shanika, you talked about systems and the way this really is about transforming systems. But also at the heart of what we're doing here is people, right? And it can be, you can lose sometimes that human element when you start to think about designing systems or talking about loan terms. Yeah. But at the end of the day, we're doing this because there's a lived experience of humans that we're talking about. People navigating caregiving, people working part-time jobs while they're learning, people in unstable housing, people with unreliable transportation. So I'd love to tell a story or two about the real human experience that maybe has a story or a person that has touched you in this. I mean, Tara, I thought about a story that was mentioned in the in the chapter, but you may have another one, but maybe you can kick us off.
Sure. So, I think that's such an important angle. And again, as we decided not just where were our values, but but we had to be pragmatic about what success looked like. And success with the target population that we were trying to support, particularly in the nursing workforce, was recognizing that in many cases, if we were getting to the people we wanted to get into these programs, that they had financial challenges and financial fragility. And there's countless studies that whatever it is, 40% of Americans couldn't afford a $400 car repair, an emergency. Those are the people who we want to be going into and succeeding in training. They're many of the people who are doing it now and dropping out. And so we recognized that we had to build in supports. And so that's why we built in a non-repayable living stipend and an emergency aid fund. And so the story in the chapter is really kind of a sad one, because it's, you talk about a return on investment. Essentially there was one of the nursing students in the program at Hudson County Community College, which is in Jersey City. Very good program. On average, you graduate $75,000, $80,000 salary as a registered nurse. This student in the program was talking about a friend who had been in the program with her who had dropped out. And she lived in Newark, which is, 5 miles from Jersey City. And she couldn't afford the train ticket to go back and forth to class. I think the train ticket now is like $6, right? You think about the lost investment. She enrolled in the program, she took on debt. This is before our program launched. What a short-sighted program design for us to build if we didn't recognize that what sounds to all of us up here and in this room maybe as a small amount of money was something that she couldn't sustain. And so that was a big driver of why we built in this living stipend, not to completely replace, someone's income. It usually means they go from working 2 jobs and being in training to working 1 job and being in training. But we also put in an emergency aid fund, and I think that has been very eye-opening for the number of sustained expenses that if we hadn't been able to give them that $1,000 for them to pay the deductible on their car after an accident, or avoid getting evicted, or pay for their child's childcare tuition, they would have left the program, or they would have not been successful in passing the licensing exam. So it's recognizing, and again, this has been an evolution for us, but if our goal at a macro policy level is that New Jersey has one of the biggest nursing shortages in the country, and we have incredible people who live in our communities who want to serve their communities, we had to recognize what do they need to get successfully through training and through college, and being warm-hearted and clear-eyed about what kind of what that would take. And I think there's a billion stories like that, but the fact that it was train fare, which is under $10 a day, shows how much investment is maybe needed here.
Jeannie, Shanika, I don't know if there's anything you'd add there, but
I just, from my perspective, we hear a lot from our candidates who are applying for administrative positions that they would love to be able to go into actually the nursing program, or even a medical assistant or some sort of technology. But again, it's the barriers. It's just those types of things. And so knowing that and knowing the impact that the Renew Fund can have, again, was just another way that I knew that this was going to be something that we could offer not only to our current team members, but to the communities that we serve. And what a wonderful opportunity that we were able to do that, knowing that these are the challenges that they're facing and this could be a solution.
Yeah. I would echo that. Both of the reflections, the train ticket, I think about the fact that so many of the communities and the individuals we're trying to serve, they are working 2 and 3 jobs. They do have other barriers there. There may be a caregiver on a number of fronts. And really what these types of programs are designed to do, again, is to share the responsibility to enable the success of those that we are prioritizing. And when I think about what the Google Career Certificate Fund is enabling with the hybrid funding model, is that we allow best-in-class training providers who are proximate to those that we're prioritizing, who deeply understand what those barriers are, And we, through the fund, we're able to provide some upfront capital to the training provider so that they can provide the child support voucher, the living stipend that's necessary. Again, because they're proximate, they understand those barriers, they understand the types of wraparound supports that the individual needs. And then on back to a point that Kirstin made in her remarks, is then on the backside, we're thinking about the downside of the success of the individuals, that we have a shared responsibility to ensure that they get placed. But what the fund also does through the Google Career Certificate Fund, what I love is that, again, the outcome-based loan, zero interest, is designed to ensure that the training provider and the financer are deeply invested. So there is, through the wraparound supports, job placement supports, coaching, interview supports to help them get placed in a job, a livable wage job, and we've identified what that income threshold is. So once the individual is placed, earns that fantastic opportunity, the intent is once they're in that opportunity, there's they then begin that repayment process over 5 years, and that repayment is somewhere around $100 a month. But again, what I love about the agility of the fund is that if that individual, for whatever reason, life happens, they lose their job or something disrupts their ability to have that employment at that threshold level, we pause the payment responsibility. And so that's the power of these types of programs, is that they are responsive, they're agile, and again, the individual is the center of what we're trying to do, because their success is our success. And so that's what I love about these funds. And so I think about folk like a Tori, who was holding 2 jobs, had the responsibility of caregiving, and she enrolled in the IT support program. She's now an IT specialist at an ed tech company. And she talks about how she had no choices. She could not get mobility because she had the responsibility of multiple jobs. And that what this program did is it unlocked potential. She said it unlocked all these opportunities that she never dreamed she had possibilities to access because of the responsibility and the burden of caregiving and working multiple jobs. Like, it's powerful, it's life-changing.
Absolutely. And I mean, I feel like we hit on 2 elements of that. There's people who see what's possible but are derailed because they don't have the financial resilience that enables them to get over what can to others of us seem like small barriers, but are insurmountable barriers for them. And for other people, and Jeannie, and you talked about this with Tori, with the assistants, it's to say, it is possible for you to even consider this path, whereas before you didn't see that. Okay, and so the people are at the center of this. And the money does matter, right? It's what gets them there. Private capital plays a role in all of these funds, but in slightly different ways. Maybe, Shanika, we can even start with you. What I think is fascinating about the Google structure is you created your own blended capital structure.
That's right.
Which I think is really innovative and unique. I know you've done it before in other contexts at Google, but what would you talk to us about that learning and experience and what brings so many different parts of Google to the table around this? And how would you encourage other people like you, knowing there's nobody quite like you, but out there, to do something similar, to consider something similar?
Yeah. I think, and Tara touched on this about values. For Google, we have always been really committed. The user stays at the heart. That's one of our 3 respects. Our values, it was the reason that we were able to get that internal support. Again, the company has always been committed to workforce. We recognize workforce development. We recognize that that the creative and economic opportunity of technology, it unlocks incredible growth opportunities in our economy, and it's spurring a digital economy. But we also realize that access is unequal. And so as we think about ensuring that everyone benefits from the creative and economic opportunity, the internal conversations were very easy. And so Google.org, as the philanthropic arm of Google, this is part and parcel of our sets of priorities. It aligns with our principles, with how do we lift everyone? How are we looking for catalytic, innovative ways in which we can elevate best practice and hopefully garner followership? So that was easy for us. When you think Google Treasury, you're thinking, wait a minute, Google Treasury is thinking about this? And one of the things that we've heard that we hear our leaders talk about inside of the company is that our Google Treasury team is always looking for ways to leverage the balance sheet to do social good. And so when this opportunity to come up with a hybrid model that shared the responsibility, took the risk away, balanced the risk such that we can help more Americans be successful and get access to high wage, high demand jobs, an easy conversation. And because it was outcome based, which is again, we're driven by data, that also made the conversation incredibly easy. And so we're proud to stand with social finance and stand with organizations like Google, Goodwill, and like Europe that have a track record. They've been trailblazing. Social finance was already investigating these kind of creative, innovative finance models that are outcomes based. And so we were thrilled because of their trends, their practices, the fact that they were already leading the way, that we could come alongside and come and provide some catalytic investment to help scale this, also amplify promising practices. And so to your point about like, how do we bring others along? For us, it was first do it.
Yeah.
Take that first step, do it, get some evidence, show that it works, and then inspire others to come alongside us, because we can't solve it alone, as all of my peers here have said. So that's how we think about it.
I love that.